We are entering a new world where the new normal revolves around working together, yet staying far apart. Because COVID-19 spreads predominantly through person-to-person contact, it is possible for an individual to be infected through a cough, sneeze, or even the breath of another person. COVID-19 can be apparent in a person who has a fever, headache, or loss of taste or smell. However, the trickiest part of COVID-19 is that an infected person can show no symptoms. This is why we must act accordingly to not only protect ourselves but those around us. We can slow the spread by wearing a mask, properly, over the chin, nose, and mouth. Wearing a mask in public can help slow the spread as well as show your consideration for others in public. You can also participate in slowing the spread by social distancing. Remember, at least 6 feet apart. Washing your hands regularly can help diminish the spread as well. So can staying home. Connecting with friends and family through platforms like Zoom can help ease the pain of missing loved ones while simultaneously keeping them and yourself safe. And now a vaccine is available for COVID-19. Getting this can help reduce the spread immensely. What's been the hardest part of personally experiencing the COVID-19 crisis?
The hardest part personally for me is going through this experience, seeing my own family in the field working with their patients, knowing that they're at constant risk every day. The uncertainty of not knowing when things will go back to normal is definitely also worrisome.
Personally, my hardship started when I lost my job due to COVID-19. The business I worked for stayed open at the beginning of the pandemic, and they forced us to work and threatened to fire us if we did not show up for our shifts. Finally, the employees, including myself, stood up and said we would not be showing up for work due to the circumstances. It was difficult not knowing how long I would be unemployed for and being unsure of how I'd pay bills. Staying at home also really affected my mental health in the sense that I went from having a very busy schedule to not having one much at all.
When COVID-19 first came out, I was terrified because I was worried about my mom and my grandma getting it, and they're both over 60 and have comorbidities, so it was very stressful when it first came out. Both of them are vaccinated now, so it's not as big of a worry of mine, but I would say the most important thing is to get vaccinated as quick as you can whenever you have the possibility, the option to.
What has living through the COVID-19 pandemic taught us?
From what I've learned from this current pandemic, I've realized the need for policies and procedures instilling employee safety surrounding a public health crisis in the workplace. As for my learning experience in public health, I have certainly been able to understand, in a sense, the science behind our current situation, the experiments, the surveys, and etc., as well as just how much research really goes into finding the causes and treatments of the pandemic.
The COVID-19 pandemic and our public health course taught me that it is very important for healthcare organization, workers, and administrators to be very prepared for emergencies. Not only should workers in the healthcare field be prepared, but individuals everywhere should try to be as prepared as possible. This pandemic also taught me that tomorrow is not promised, and showing each other care and respect can help save lives and protect people.